Good afternoon, everybody, and welcome to the workshop of the BOCC for this November 21st. Would you all please rise for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, today we're going to have a discussion as it's related to House Bill 1085 for secure transportation on county licensing and the requirements. And with that, I'm going to turn it over to our attorney, and we also have our public health director in here.
Basically, House Bill 1085 delegated licensing authority for secure transport vehicles that provide secure transportation services for individuals in mental health crises over to the counties. And beginning January 1st of 2023, counties are going to be in charge of licensing these secure transportation vehicles in the same way that we license ambulances. As part of that, we need to look at passing a resolution and then putting together a packet that conforms with some of the state statutes pertaining to emergency vehicles, these emergency vehicles. So we're set up to get folks licensed. And so what I did, I borrowed quite a bit from Archuleta County and from Montrose County. Their county attorneys have been kind of heading this up for a lot of the counties here in the Southwest. They were a huge help. Borrowed some of their documents and kind of made a few tweaks of our own. But I included those documents in your packet. A lot of the documents are obviously just license forms, permit forms, forms for maintenance checks that have to be done on these vehicles. And so, I assume you guys have had an opportunity to review those documents. If you haven't, I would suggest that you do that. But really, I think for today's purposes, there's just a couple things that we've got to hone in on and try to make some decisions just so we can kind of hone in these policies. I guess the first thing that we need to decide is who our county's licensing coordinator is going to be. In other words, who's going to be in charge of taking these documents and kind of heading up the process, interacting with individuals or companies that might want to get these vehicles licensed, et cetera. I mean, my assumption at this point in time is it's probably going to be the vehicles from Axis and then also vehicles for our community intervention program. I don't know of any other vehicles in the county that would provide transport. I don't know if there's a need for like a sheriff's vehicle to provide these kind of transports.
Come to a mic. One of the mics, Bobby, because you're part of this conversation also.
So that, on the webinar that I attended with the state on this one, it depends. Law enforcement basically is exempt from this criteria.
Okay.
So law enforcement would not be a necessary thing to have those permitted or licensed. The other ones that came up, like I had a private phone call with the state with specific questions about our county and vehicles in our county to ask real specific questions. And that's where I got a little more information. And they definitely said our CIP vehicle would absolutely need to be permitted and licensed and permitted. The same thing with Axis Health Systems, all of their vehicles. Like a private entity such as Cortez Cab, no, because this is, you are knowingly transporting someone in a behavioral health crisis. So that's not to say nothing could ever not go wrong in your vehicle in the middle of transporting somebody, but it wasn't that you were intentionally doing that and that was not your purpose. You might have been taking somebody to an appointment, but
Yep.
So that would not be needing to be going through this process. One of the things that I didn't think of when I was on the phone with them, and that was, does social service ever transport someone to a behavioral?
Generally not. I mean,
Okay.
social services would be in the same position as, say, something like a Cortez Cab. I mean, it's not inconceivable that we would be transporting somebody who would be experiencing mental health issues, but we wouldn't be knowingly transporting them for the purpose of receiving that sort of mental health treatment.
Because that seemed to be the delineation when I
Exactly.
was having that conversation with the state, is,
Yep.
you know, was that the intention of that person getting in the vehicle? Was to go
Exactly.
get service? And so.
And
anyway.
that's the delineation too in the statute. And you know, from a social services perspective, I mean, certainly, if somebody's having a mental health crisis, we shouldn't be doing that sort of transport in that situation. And so, I don't foresee the need to license any social services vehicles for
Okay.
purposes of this statute.
So really, we're only talking about, as it stands right now, not that it couldn't be added,
Sure.
but access and our CIP
Right.
ban right now. So basically two more, which right now, public health does all of our licensing for
Yep.
the
For the ambulance.
ambulance.
Mhm.
So would it be that big, I think your question is, where do we leave it at and who's responsible for it? I guess I'm asking you, would that be another big burden, or would it be something that's basically in the same line as what we're doing with the
Sure.
ambulances right now?
And with the ambulances right now, it's really just administrative that where it houses with us, and then our medical officer signs off on it. But the EMS department, they take it to a mechanic, they get that of their choice, and they get that part done, and then our health officer goes through and does the inspections with EMS on the actual, you know, of the checking off of the ambulance sheet. And then we process it and send it all to the state. So it's really admin that we do, and we don't charge anything for the ambulance services at this point in time. However, seeing this and what is required with this, a deeper dive into our ambulance statute, I think there's pieces that we do need to develop with ambulances, such as complaint forms. There needs to be a complaint process, the same as this, because
Well,
that's written.
And so that's interesting. I mean,
Yeah.
there's different ways that we can handle that. I mean, obviously, you know, there is a provision in the statute for ambulances for complaints to be filed. You know, how we want to advertise that or make that available, you know, there's some discretion there. So I think that's a conversation for another day.
Okay.
That's a different thing to take up for another day. But, you know, today, I think we need to hone in on the licensing requirements for these secure transportation vehicles. Bobby, I think you bring up a good point. It sounds like with the ambulances, what the county does is it delegates the responsibility to the provider to go and get these mechanical checks done. Certainly, that's kind of what I contemplated, and I think that's what, you know, some of these counties have contemplated. There are counties, I think, that are actually doing the checks themselves. So they would have somebody from their maintenance department, but those are generally going to be larger counties. My suggestion would be, you know, allow folks to take the vehicles to a local reputable mechanic, have them fill out that form that's included in these
So
packets.
looking
and
at
do
that
it.
form, it's just basically a DOT compliance form, right?
I don't know what a DOT compliance form looks like, but I know what this form looks like, and it's a checkoff list for a mechanic to do.
Yeah.
Brakes, so on and so forth. But then there's a whole nother check sheet where that's where our medical officer would come in, and I've already had a little sidebar conversation with her to see if she would be willing to do this, and she's totally on board to take that on
Correct, but
too,
it's not
so.
medical on this? I mean, we're not actually providing medical services like an ambulance? This is just more
No,
of a
this
transport?
is for these transport, the
Right.
secure transport
So
piece.
we also, or do we, so there are transport vehicles that Southwest has, other than the ambulance, which are, do we license those too?
No, not, if they have them and they fall under this, that's a whole nother conversation. I don't know if the hospital has
So-
vehicles that they securely transport with that are non-ambulances. I don't know.
Okay.
I'm not sure about that.
What is it that the health individual would be looking at in these cars? I mean, this is a little bit different than an ambulance.
And we were just gonna lump it into her purview because she signs off on the ambulances, and she's familiar with going through the checklist, and we just thought it would be simpler to just have her do it, but, you know, we don't have to have it if that way. Again, this is up to the county commissioners to decide, and you don't even have to house it at public health if you don't want to, but to me, that's why I'm here, because we already do the ambulances, we're a little familiar with that, but I didn't know if you wanted another department to take it on, but we're willing to do this.
It makes the most logical sense to me. You're already doing it for the ambulances, which is an ALS unit, compared
Right.
to a transport unit. And that's the difference that I see. We're not providing ALS in
No,
these units.
no.
If ALS is required, or even BLS, it's moving to an ambulance, where these are just transport.
Yeah, I'm
The
not
way I
sure
read
we
it-
would necessarily need the health director, the doctor to come in and inspect this kind of a vehicle, because
And if
obviously there
we-
wouldn't be much to inspect. I mean,
No.
this is more of a transport
It's
vehicle.
just transport.
Yep.
So I would say keep
Sure.
it
Well,
within
then-
your hands, because it's gonna be much simpler than a
Sure,
ALS
I
or
don't,
BLS
I don't
unit.
see why that, I mean, I don't see why that wouldn't work.
Because these are basically safety checks. Is the
Sure.
unit safe to go down the road? Can it stop? Does it have good rubber on the tires? I mean, it's,
Yep.
that's kind of how I read this.
And the whole
So-
reason this came into play was that they just want counties to be sure that there's like a minimum standard of transporting people that are in behavioral crisis
Right.
mode.
So the fiscal
So-
note for us, what, is that something that we can charge back to the state, because they can't impose this on it?
We
if
can't.
can't,
We can't necessarily put it back to the state, but we can charge a licensing fee.
Right.
And counties are doing that.
Right.
And so, you know, what we want to charge for issuance of these licenses is totally within our discretion. My suggestion, and kind of what Bobby and I informally talked about before today's meeting, was the possibility of just charging an amount that's going to cover
Yeah.
our costs.
just,
And so I don't know what that would be, and I don't know how much time is going to be involved in this. Bobby, I don't know if you really know, you know, but
I haven't
would-
spent a lot of time thinking about the time, because if this wasn't going to land on us, then I didn't want to put a lot of time into it. So, but now, if it's going to be ours, then I think, I do think that we do need to have some reimbursement. So some sort of fee is going to have to be charged, and charged to the entity that has the vehicle
Yep.
that they want licensed, or they have to have licensed and
Right.
permitted. And just, and I don't know if you want to share, like, just an example. I know, like, Archuleta County, they're setting a licensing fee. There's two fees. There's a licensing fee, and then there's permits, and each permit has to be per vehicle. So you have one licensing fee, and you operate under that, and you permit each vehicle. So Archuleta County, for instance, is charging a $400 licensing fee,
yep.
and then a permit fee of $100 per vehicle. And it's good for 3 years, it's my understanding. So it's not that you have to do this every year, it's
Correct.
every 3 years. So,
Correct. So just like we talked about in our last Board of Health meeting, you know, fees, once we know what it actually takes us, we could charge that fee based on what it truly costs us. We're not, you know, there's no fluff in it, it's just what does it cost us. So the plane's coming in for a landing, so get ready.
yeah.
'Cause it's
And I
landing
mean,
on public
to
health.
me, I thought the fees that Archuleta County are charging, I think I think they're fair. Because, at least, maybe just initially, because we have to get a lot of ducks in a row here. But I do think that, you know, there does need to be some of these pieces established, because people do have to have, that's in this statute, that you know, there has to be a process if there is a complaint in regards to this secure transport. So there does have to be a form and a process for reporting those complaints that's written in there. So those are things we have to think about and develop. And this is all supposed to go into effect January 1,
Right,
so, of 23.
So,
So, yeah.
those are my comments. I mean, obviously, I would like to keep it with you. You guys are set up the best to handle it right now. And it
So
makes the most sense.
the other piece that, you know, Ian and I were talking about was just the mechanics of it, and I think that's a decision that you all maybe could come up with if you want it to allow the institutions to have their own mechanic, or if there's certain mechanics that you want them to use. you know, I know we have the vehicle maintenance department, I don't know that you want to put that on them, because then that's a whole nother financial piece to figure out what it would take them to do that burden.
Well, they're
So, I don't know.
maintaining it,
Yeah,
well, they're maintaining the CIP van anyway, so to do a DOT inspection on it, there's not gonna be anything that they're not used to anyway with all of the other,
so I guess that's
equipment
part
that's
of the
out there, so-
decision that you guys
My-
have to make too.
My suggestion would be, let's do our own CIP van,
Yeah.
and then let's let whoever's getting vehicles licensed go out and go to a reputable mechanic in the
Yeah.
community and get it done. And
Yeah.
they can pay the costs, and that'll be that.
and I agree.
And that's how the ambulances are done.
Yeah.
I
You know,
agree.
they take it to whatever mechanic they use at the hospital, so, you know, anyway.
I guess the one other thing that's floating out there, and you know, you guys can certainly give me instructions if this is something you're interested in. Some of the larger counties in the metro areas are banding together and doing one licensing entity for multiple counties. In other words, I think like Jefferson and Adams and a couple of the big ones have banded together, and they're licensing vehicles across multiple counties just because of the size of some of the counties up there. There hasn't been any talk amongst at least the county attorneys here on the western slope about doing something like that. I know Region 9 is working on some sort of a reciprocity agreement that would allow, you know, somebody who is licensed here to operate in, say, La Plata County or Archuleta County, et cetera, et cetera. But, you know, I think the reciprocity agreement's kind of separate. At this point, my recommendation would be, let's just go ahead and issue our own licenses for our own providers in this county. But I just wanted to throw that out there, just so you guys know that that is something that's out there that's being done.
Okay.
Yeah, and Ian, correct me if I'm wrong, but it sounds to me like from the place of launch, the place of where the vehicle is starting out, their transport, that's where you have to abide by the rules and regs of that county. So if we
Yeah.
were driving someone over to Pueblo,
I
they have
think-
to follow our rules and regs here.
I think that the advantage of some sort of a reciprocity agreement would be, for instance, the ACU center is over in Durango. And so somebody in this county may be able to transport a Montezuma client over there, leave them there, but then the pickup's more tricky once they get discharged. I mean, you would hope that they're not in a mental health crisis at that point, but at the same time, you know, there are situations where maybe somebody would be discharged out of La Plata County for whatever reason. It's a Montezuma County resident, and you've got, say, Access Mental Health here in Montezuma needing to go do a pickup. So that's where that reciprocity would be advantageous. And so that's something that we'll continue to work on. You know, but at this point, for our county's purposes, we just need to move forward with the resolution and adopt those forms if that's what you guys are okay with. My suggestion would be, you know, now that we have some idea that the health department's going to be the lead here, that's what it sounds like to me. Let me just tweak these policies a little bit. I'll get them back out to everybody, and then we can get this on the agenda for adoption of this resolution, say a week from tomorrow.
Okay.
Does that work for you guys?
Good.
And do you want our fee of what it's going to cost? Do you want that before you actually
Yep.
adopt it? Or,
Yep.
I mean,
I think it should be there.
okay.
I mean, we already have an idea of what other counties are doing, but we have our own numbers. We can put our own numbers to it to see if it's actually gonna be,
And
correct
it
or
might be
not.
one of those things that we just, you know, as it grows, if it grows, as it grows, we
Sure.
have to revisit
Well, it
those,
has to
but,
be
you know,
changed if
so,
it grows.
right, so,
Yeah. Yeah, so if you wouldn't mind shooting those numbers, then
Okay.
I can stick a little fee schedule in, and we'll
but
be
it's
good to
kind of
go.
already adopted. If the licensing fee that they have established is the 4.25 and the permit fee is 100 per vehicle, it's only gonna grow per vehicle. I
well,
can't
that's what
imagine-
Archuleta County has,
Right.
right, yeah,
Ours may be different. It could be whatever,
yeah.
but it kind of is pretty well
I mean,
established.
to
so-
me, I think that's a fair place to start, and we might be able to lower it, I don't know, you know, but initially, it is gonna take
Sure.
time and work to
Sure.
get this up
For
and
the
running.
licensing,
Yeah.
for sure. Okay.
So, okay.
Anything else?
No.
Nothing?
No? No. I can stand here and talk more if you want.
No. Thanks, Bobby. Okay, gentlemen, any further discussion on this one? I think we pretty well have it lined out. Ian, you have your direction, and we can have it on the agenda in a couple weeks.
Sounds good.
Okay?
Okay.
All right, well, we basically have only one thing on our agenda today. I would like to put a big shout out there to the Dove Creek Bulldogs for winning their football game on Saturday, and you guys rock. And we will conclude this meeting. Thank you.